This is Dr. Shravani Reddy joining in from Click to Clinic Home Healthcare India. I've got with me today two exciting speakers joining us to give their expert insights on the topic that we're going to be discussing today. This month has all been about cancer. We're all talking about cancer awareness and for all the right reasons. So today we wanted to talk specifically about the thing probably most controversial in the title. Can we and if we beat cancer? Is that a possibility? Is prevention an option at all? So to join us in the conversation and help us understand what are the most common caused cancers in men and women, gender specifically, and how to prevent them, let me introduce you our speakers for today before we begin the session. I've got with me Dr. Ashok Vaid, Padmashri awardee by the President of India, the head of oncology from Medanta, who's joining us today live. Thank you so much for joining us, sir. It's a pleasure to have you. And we have Dr. Sai Daayana, the Urogynecological Oncologist from Apollo Hospitals, Jubilee Hills, Hyderabad, who's a UK-trained consultant in both gynecology and oncology, who's joining us today to share her insights about the cancers in women. So allow me to share my screen and we begin the talk with, firstly, with the cancers in men that Dr. Vaid will take over. Over to you, Dr. Vaid. Dr. Vaid, am I audible? Are you here?
Thank you, Shravani, and thanks to the organizers for giving me the opportunity to be a part of the proceedings this evening. And I look forward to a lot of interactive session, and towards the end, I do trust and hope that we could make a bit of a difference in the understanding and a more commitment towards an early detection prevention of cancer. Because as is very appropriately said, prevention is better than cure, and you need very little to do in terms of the preventive measures. Next slide, please. So something very basic, what is cancer? And as a layperson, one could call it as, cancer is a large group of diseases. You know, as a medical professional, we deal with almost about 150 to 200 cancers in the human body, out of which about 40 to 50 are common in the clinic. And cancer is actually an uncontrolled growth of the abnormal cells, which have stopped obeying the commands of the body. And they not only produce what is called as a tumor, but they have the ability to spread to other areas in the body. These are rogue cells, these are uncontrolled growths, and therefore do not obey the commands of the body. Spread to other areas is the hallmark of this disease. Next. We know and understand a lot about the cancers. Maybe we do not understand everything about cancers, but something which is very obvious is that cancer does not evolve overnight. It takes many, many months and years sometimes, depending upon the type of the cancer, the biology of the cancer, how quickly the cells are replicating, they're dividing. Therefore, the journey from one abnormal cell to the time we detect it, that's about a few centimeters of tumor. It's a large conglomeration. It's a large collection of cells. And one can see from this slide that 1 million cancer cells are equivalent only to a head of a pin. And a tumor which is large enough may have about a few billion cancer cells. Next. So this would be something very basic to our understanding. Next. And as I said, that there are numerous types of cancers. Why? Because the body is composed of many different types of tissues. There are tissues which line the outer cover, the inner linings of the various organs, and there are connecting tissues. Next, Shravani, we can move these slides quickly. And then there are linings of the body. There are connecting tissues. There are bones and other softer areas. And the next, the cancers could evolve from specific organs. Keep moving these slides, please. And they could evolve from specific organs like the lung and the breast. They could evolve from some of the other organs like the small and the large intestine, urinary bladder. These are called as carcinomas because these are the cancers which evolve from the linings of the various organs. Next. Keep moving, please. And as we know that there are cancers associated with the blood and blood associated organs like the lymph nodes. These are called as leukemias and lymphomas. And connecting tissues, as I said, they are the support organs of the body. They lead to cancers what are called as sarcomas. Now, cancer as an entity actually kills more globally. If you look at these bar diagrams, these are self-explanatory. Tuberculosis, HIV/AIDS, malaria, put them together, cancer still kills more people around the world. Though the incidence and the occurrence of the cancers varies from one geography to another, and therefore the outcomes are also dictated by the resources, the access to treatment, but one can actually come down to certain risk factors of cancer. And as this slide tells us, something which is very obvious is that tobacco is the number one culprit. There are about 30 to 40% of the cancers which are associated with tobacco. We need to do a lot in terms of the anti-tobacco campaign. One puff of cigarette contains thousands of chemicals, out of which about 50 are cancer causing. Imagine the amount of damage it can cause, not only cancer, but causation of lung diseases, heart, peripheral vascular diseases, and then so on and so forth. So many are linked to the usage of tobacco. India does not have a very great sort of statistics as far as tobacco consumption is concerned. We are amongst one of the high tobacco consuming society, and therefore the number of cancers which are associated in India with cancer is really, really very high. Lung cancer is one of the common cancers in India. So is are the cancers associated with the chewing of the tobacco, which is called as the smokeless tobacco. And India is actually has the dubious distinction of being the oral cavity cancer capital of the world. And therefore, as I said earlier, we need to do a lot about the smoked as well as the smokeless tobacco. Some of the warning signals we are asked in the clinic time and again that what should happen to an individual to suspect that it could be cancer. These are very general, generic symptoms, but they could be associated with cancer. Not only cancer, they could be a manifestation of many other diseases, but then cancer being a more sinister disease, more serious disease, these should be brought to the notice of a physician. And this involves a change in the bowel or the bladder habits, a sore that does not heal, be it in the mouth, over the skin, anywhere in the body, and an unusual bleeding or discharge. You would hear more during the course of the discussion, thickening or lump in the breast, indigestion or difficulty in swallowing, obvious change in a water mole over the skin, and nagging cough or hoarseness. This could be indicative of lung cancer. Now, as far as screening goes, there are some basic tenets of screening. It should be screenable. What we say that there should be a test available for a particular cancer to be screened, and obviously the numbers have to be there. It should be like a public health problem, and the numbers have to be in significant proportion so that when we do the screening, it leads to the benefits in terms of early detection and bringing down the stage at which we pick up that cancer. We have screening tests for colon, breast, cervical, and prostate cancers, and self-examination could actually lead to early detection of any changes, be it testicular or the skin cancers are involved. Next. Talking about PSA, the PSA is the full form is the prostate specific antigen, and Doing a digital examination with a finger examination through the rectum, these two tests are recommended for men above the age of 50 and in a particular subgroup of people below the age of 50 where there is a high family history and there is a suspicion that the other siblings or the other members of the family could be at risk for occurrence of prostate cancer. They could be screened below the age of 50 years. And especially the Caribbean, the African ancestries, they are more prone. So there the screening is actually recommended even at as early as 45 years of age, 40 to 45 years of age. Coming back to the slide I showed you earlier, India has a huge commitment towards the control of tobacco, but India has not set a deadline. Many countries around the world have set a deadline. And then this is one of the preventable catastrophe and preventable epidemic. Imagine a box of cigarette or tobacco contains virtually a poison without listing what is inside, what are the contents inside that. Even a bag of bhujia today needs to be labeled about the contents and the calorie count. The tobacco goes actually, scot-free. And WHO has already given an alert that some of the cancers would be as high as about 20% linked to obesity, viruses, women's cancers. You would hear much about that. One of the interventions which leads to very clear benefits are the vaccinations for hepatitis B, and you would hear about the human papilloma virus in connection with the cervical cancer. Family history, we just cannot change. What genes I'm born with, I cannot change, but the lifestyles, obviously I can change. And then as you see from this table, almost about 50% of these cancers are preventable. So ladies and gentlemen, let's join together and say that what could be done should be done. And then it is possible to actually cut down the number of cases of cancer which are happening in this part of the world. And now the developing world is by 2030 going to host almost about 70% of the global cancer burden. And it's imperative on the part of each individual to take care of one's own health, love yourself, take care of your health, and stay healthy and adopt a more healthy lifestyle. What do we need to know? We need to have more information going to people. There should be a war on tobacco, avoid infections, vaccinations, as I said, early detection, and there have to be more treatment packages next. And of course, we need to develop more cost-effective treatments, no doubt about that. But at the same time, dispel myths associated with cancer, like cancer is infectious. No, that early cancer does not have a lump which is there and is painless cannot be cancer. No, early cancers do not have pain. It's a manifestation of an advanced disease. So don't presume that there is a lump in the breast or elsewhere in the body system and it's painless. It's not cancer. One needs to check up with a doctor. And then, of course, we need a very comprehensive national plan. All of us need to join together. I thank you for that patient listening. And back to Shravani.
Thank you so much, Dr. Vaid. Before I pass on the time to Dr. Daayana, allow me to ask one question on behalf of the audience to you from a cancer in men's perspective. Now, tobacco is something you've been very vocal about and strongly put forward. If we have to talk about what are the top 3-4 cancers that one needs to look out for, what would those top 3-4 be for men today who are attending? What do they know?
So for men, it's majorly tobacco, head and neck cancers. We have oral cavity cancers, 2 lakh cases every year. Lung cancer, more than 1 lakh cases every year. So men are actually more afflicted with tobacco-related cancers. And of course, the incidence of colorectal cancer is colon and the rectum is going up because our lifestyles are changing. And our diets, our habits have changed.
Right.
Still, the vegetarian diet is protective because the fiber content is more. We are not consuming as much of red meat. But again, it all boils down to tobacco, and lifestyles.
All right. Thank you so much, Dr. Vaid. I will get back to you once we are done with the discussion with Dr. Daayana, and we'll have more questions for you then. Thank you. Dr. Daayana, over to you. Can we talk about cancers in women?
Yes, of course, Shravani, and thank you for the initiative. Every little we can do to help prevent cancer or catch it early, obviously, is going to make a huge difference. Moving on, I'm going to solely focus on cancers that happen to women, which we can see in this slide. And I have taken the top 5 cancers which are affecting women in India. So per se, we are mainly focusing on cancers in women. And the topmost is the breast cancer, extremely common. We still do not know what exactly causes breast cancer, but we think obesity has a very big role to play. The second commonest, or in fact, which is almost as common as breast cancer, is cervical cancer. Cervix is the lower part of the uterus. And of course, every woman is born with a uterus. And unless she has a hysterectomy, which has the uterus removed, each and every one of us women who owns a uterus obviously is at risk of cervical cancer. We will very soon start talking about what causes cervical cancer. The third most commonest cancer in women in India is a mouth cancer or oral cancer or lip cancer or throat cancer. Both mouth and throat almost have the same risk factors. The fourth most common cancer in women in India is ovarian cancer. Ovaries are the organs which make hormones. Ovaries are the organs which make eggs. And ovaries are situated right next to the uterus. We have 2 ovaries. And ovaries are very similar to testicles in men. They have exactly the same role. And then the fifth commonest cancer in women in India is intestinal cancer, which Dr. Vaid was just mentioning. And that is increasing in number, again, due to our changing lifestyles. Majority of us are preferring non-vegetarian diets. Majority of our lifestyles don't allow 3 full balanced meals a day. We eat at odd hours, we eat high processed food, and we don't include much fiber in our diet. Moving on to the next slide, I'm now solely going to focus on the breast cancer. I've already mentioned it is not quite clear what causes breast cancer. Obesity is a risk factor. Family history is a risk factor. But that doesn't mean if there is no one in your family with breast cancer, you won't get it. A lot of women I come across when I advise them to undergo a mammogram, they say there's nobody with breast cancer in my family though. So you have to realize that breast cancer can happen to anybody. And breast cancer can be very subtle. It's one of those organs which is right in front of you. You can see it every day. You can touch it every day. You can feel it every day. Still, there are a lot of breast cancers happening and people don't always know that they have it until it becomes like a big lump and gets very painful. Sometimes you ask women, what did you do? What were you doing when this cancer became so big? Because it's a huge lump they come with, or blood pouring out of the nipple or a big ulcer. And they think, I actually don't look, I don't touch myself. So it all comes back to please know your body, understand your body, and please get yourself tested. Before you go to somebody to get yourself tested, first touch yourself and see yourself. Because breast cancer can be like a lump. It can present like a skin discoloration. It can present like redness on your breast. It can present like pain in your breast. And it can present with nipple changes. But do realize that 90% of breast pain and 90% of breast lumps are not actually cancer. Even less than that are cancer. But how you at home when you get breast pain or when you have a lump know if it is a cancer or not? And that is when you have to come to us to get yourself tested. Moving on to cervical cancer. Moving on to cervical cancer, which has been the commonest cancer in all developing countries. I want you to focus on one thing. If you don't have sex, you won't get cervical cancer. Because cervix is the lower part of the uterus, and the cervix gets touched and gets rubbed and gets constantly infected when a woman has sex. But this infection is not because your partner has been sleeping around. The infection is not because he got you diseases from elsewhere. Almost all of us have a virus on us called HPV. Some of us have different strains of this HPV virus. Some of them are more nasty than the others. And obviously, the more sexual partners a person has, the more HPV viruses he or she is going to get on their body. And when a woman starts to have sex, the HPV goes into the cervix. A lot of us have HPV virus, but that doesn't mean we all get cancer. But for whatever reason, after a few years of getting the HPV virus, when you're immunosuppressed or when you're not feeling well or when your body feels weak, or if the virus is strong, suddenly the HPV virus starts to make you have an infection. And about 5 years after you get the HPV infection with changes in your cervix, it will turn into a cancer. And again, like Dr. Vaid said, the early cervical cancer is totally asymptomatic. You could be walking around with an early cervical cancer feeling 100% fine. But when that cancer gets big and it makes you have irregular bleeding, a backache, a pain in your pelvis, or painful sexual intercourse, or bleeding during sex, that's when you come to us. But then it's too late. How much ever you pay me to treat you and how many ever treatments I offer you, you're still not going to live longer or get better. So sexual activity associated cancer, called cervical cancer, doesn't just limit itself to cervix. If a woman has oral sex or a man has oral sex, this HPV can go into the mouth or throat and cause mouth cancer or throat cancer. The moment we talk about mouth and throat cancers, you're thinking tobacco. But what we don't tell on those cinema screens is you have sex, you could get HPV in your mouth, you could get oral or throat cancer 20 years later. None of us are going to like those kind of advertisements. None of us want our kids to watch that, but that is the truth. Half of oral mouth, lip, and throat cancers are due to HPV, which is due to oral sex. A lot of penile cancers, cancer of the penis in men, which is not very common, thankfully, is due to HPV. People who engage in anal sex, again, it's due to HPV in almost 50% of the cases. So just by being sexually active, a man or a woman is exposing themselves to HPV virus and therefore subjecting themselves to either the cervical cancer, which is a killer disease in India, or mouth, throat, penis, or anal cancer. Moving on. Should we stop all men and women from having sex if having sex puts them at such high risk of getting cancer? Obviously, that's not going to be feasible, nor practical, nor advisable. So what can we do instead? When we were younger, we did not have anything else to do other than be careful. Even now, the motto is the same. A person has to be very careful about choosing who their sexual partner is. But additionally, for the past 10 years, we have been able to vaccinate our children against HPV. So recently, there has been a vaccine, which the WHO has made mandatory. Every child aged between 9 and 16 should receive HPV vaccine. The age is chosen to be 9 and 16 because you don't expect someone less than 16 to be sexually active. So by the time they start getting ideas about oral sex and anal sex and normal sex or whatever, they're already vaccinated and you can protect them from the virus, which can cause them problems in future. And what about those women who are already sexually active? What if they have HPV infection? How do we find out? What we call a pap test or a HPV test taken from the bottom end of the uterus. That test in itself will tell you if you in future are going to get cervical cancer or not. So the killer disease in India, which is killing a woman every 8th minute, can actually be completely prevented if every woman has a pap test every 3 years. We're not saying have this test every month or every 3 months. We're saying have it every 3 years and that's enough. That in itself will stop you from getting cervical cancer. And if there is any one of you out there who has a child aged between 9 and 16 and they haven't been given HPV vaccine, please do it as a matter of urgency. This could protect their life. And there are only 2 HPV vaccines globally, only 2, and these are the only 2 licensed by FDA, and this is the dose regimen. You advise it between 9 and 16, but if you have someone at home who is more than 16 and not yet sexually active, of course they could take this vaccine, they're eligible too. Moving on, this is the right age for the vaccination, where child, when is still a child, is best protected. And this is mandatory by WHO. It's not my recommendation, but it comes by WHO. WHO. The other developed countries obviously do it, as per the government regulations, but we in India have no such regulation. You parents have to take responsibility and ownership and go get your child vaccinated. And if I'm telling you that this HPV vaccine or the pap test for women can actually protect them from that HPV associated cancer, how effective do you think it's going to be? Well, it's almost 97 to 99% effective. So there's absolutely no reason to shun these tests and think that, okay, they talk about these things, how protective are they going to be? They're very protective indeed. Moving on to colorectal cancer, again, I'm just repeating what Dr. Vaid said, which is it's increasing in numbers. And if you think about it, all we suggest, all we request you people out there is once you cross 50, please give a stool sample. We test that stool sample under the microscope and tell you if you're at risk of cancer in the intestines by looking for small quantities of blood in your motion. And if you think about it, what is one stool sample? Is that a lot we are asking from you? Moving on to the next slide. One simple urine test which you give in your master health checkup or routine health checkup can look for any traces of blood in your urine. We can look for blood even when you don't see blood in your urine. And if we see blood in your urine, then we say, go get an ultrasound scan, see what's happening. And then if we might spot a tumor in your kidney or anything like that. And all it costs is one urine sample, just one urine sample. Imagine how much is going down the drain every day. Next, please. And we all think about cancers. People are always talking, how do we protect ourselves from cancer? And we blame smoking and alcohol plenty. Rightfully, smoking and alcohol cause a lot of cancers. And obviously, none of us like to be in that stage where we are smoking or drinking a lot. And if you happen to have someone in your family who is smoking and drinking a lot, obviously, we are always trying our best to stop them from doing that. But one of the biggest and even worse risk factors for cancer is obesity. We are not always shunning away the obese people in the family. We ourselves could be obese. And we easily understand that there is something called fat gene. A person who is dead slim can be eating like a hog and still they don't put weight on. How much ever they eat, they stay slim. And unfortunately, there are some people who eat very, very little and still manage to put a lot of weight on. And then it makes you wonder, what on earth is happening? Why is God being so unfair to me? How come some people eat so much and stay slim? How come I don't eat anything and then I become so fat? And this is something called fat gene. Unfortunately, it can sometimes happen where you inherit the obesity from your parents. And if you have the fat gene, you very easily put weight on. But that just doesn't mean the obesity is acceptable. How much ever fat gene you have, however strong genetically, you have a tendency to become obese. If you're obese, you're at a much higher risk of cancer. And as a society, we accept obesity much better than we accept smoking or alcohol. And I think that has to change. When people are obese, they need to acknowledge that it might be because they are overeating or exercising less, or it might be because they have inherited a fat gene, or it might be because of a combination of various things. And obesity is one of the highest and the biggest risk factors for cancer. And one has to really pay attention to focusing on the obesity. And now talking about what can we do? What lifestyle modifications can we adopt to reduce the risk of cancer? Well, we talked about obesity. How you choose to eat, how much you choose to eat, when you choose to eat, and what you choose to eat is always under your control. Every patient who comes to my clinic asks me at the end, so doctor, what should I eat? And I tell them, don't ask me what should I eat. Ask yourself what you should not eat, because only you know what you're eating and how much excess you're eating. So eating is a passion, eating is an obsession. Let we eat for the sake of being alive, not just because we have nothing else to do, waste it down and eat. And this is an example of 400 calories in a person's stomach. It could just be one small portion of something very fattening to a tummy belly full of salad, which still is 400 calories. We need to understand that health is not just physical health. Health is emotional health, spiritual health, mental health. And we need to learn how to calm ourselves down. We need to learn how to unwind. because the life is getting extremely stressful. And the other thing is we are all worried about the increasing cancer risk in children. A lot of children are getting diagnosed with cancer. I'm seeing a lot of young ladies between 20 and 30 with polycystic ovaries who are not getting proper periods, who are putting on weight, who are getting extra hair on the body and face, who are not getting their periods properly. And by the time they are between 25 and 30, the uterus is gone so wrong inside that they're coming to us with cancer in the uterus. And almost each and every one of them is overweight. And then this is the group where they actually don't eat much. They just eat a very little bit of junk now and again in between studying. They're on their systems all day studying. They barely exercise. The periods go missing. They're diagnosed with PCOD. And then later they come to us with cancer in the uterus. And you can't force your child to exercise if you're not. So be the example which you want your child to follow. Reduce the time children and adults and you yourself spend on electronic gadgets, and try and get out, try and do more physical exercise and be an example for your child. The previous slide, please, Shravani. Oh, I think you deleted it because it was uploaded. That's fine. I just wanted to give you an example. Next slide, please, Shravani. What I wanted to say was, say, for example, I work in Apollo, so I can only take an example of Apollo. Say, for example, today you came to me, you're 42 years of age, and you asked me, doctor, how do I protect myself from cancer? And you haven't recently undergone any of the tests we wanted you to undergo. Then I would say, why don't you take up a package? Because packages are always discounted, packages always come at a good price, and then it's a comprehensive list of everything a woman of your age group might need. Say, for example, a woman who is more than 40 years of age, or any woman who is sexually active or who has been, I would strongly, in fact, make it mandatory that she has a pap smear every 3 years. If you cross 45, we like you to have a mammogram. A mammogram can detect a cancer which is smaller than the size of a rice grain. Even my fingers can't detect a cancer which is less than 2 centimeters, because fingers are fingers, we only touch. But a mammogram is a combination of a scan and an X-ray, and it can show even very small cancers or precancerous lesions. And intestinal cancer, like I said, we take a blood sample, we take a urine sample, we take a motion sample, we check out your lungs because lung cancer is on the increase. And Dr. Vaid already mentioned active smoking and passive smoking. And then we do your mammogram, we do your pap test, and then you get a comprehensive package. And something as simple as this would probably only cost you between 3,000 and 4,000 rupees. I'm not promoting Apollo here, but a cancer screening package in Apollo on this day costs you rupees 3,500. Shravani will do the videos at the end if you don't mind. And one more thing I meant to say was, these packages come at a very small price, and sometimes that could save a person's life. And please do focus on not just spending the money on you, but people you know. There are some less fortunate people than you who might benefit this package or a gift of health. Shravani, can we go to the very last slide, and then I'll go back to my videos, if you don't mind? Yeah, and the next one, please. I just want to ask the audience one last question. For a small price, anything between, say, around 4,000, 5,000 rupees, you could get a health checkup, which will tell you how you're going to be for the next 1 year. It will focus on your blood sugar, your cholesterol, your thyroid, your cancer risk, and then will give you an advice. How much else can you buy? What else can you buy for that 2,500 to 5,000 budget? A meal, a piece of clothing, a jewelry item, and how long will that last on? So please do think more sensibly when you're thinking about spending money on yourself. Please do spend it because it's worth it. It might save your life. I have 2 small videos on breast examination and what we do when we take a pap smear. And with that, I'm going to end my talk. Thank you. Shravani, we can't hear the video.
How about now?
Let's get started. Step 1. Stand in front of the mirror and check your breasts for the changes, including change in your breast size or shape, thickening of the skin in the breast or underarm area, swelling, warmth, redness, or darkening of the breasts, dimpling or puckering of the breast skin, an itchy, scaly sore or rash on the nipple, pulling in of your nipple or another part of your breast, or pain in one part of the breast. Step 2. Now raise your hands and look under your breasts for the same changes. Also feel for lumps or hardness in this area. Step 3. Next, check your nipples for any discharge or fluid secretion. Nipple discharge may be watery, milky, yellowish, or even tinged with blood and should be checked immediately. Step 4. Lie down on a firm surface on your back and using slow circular motions, feel your breasts for any kind of lump. Follow a pattern to be sure that you cover the whole breast. You can begin at the nipple, moving in larger and larger circles until you reach the outer edge of the breast. Check the inner part of your armpit as well. Always use opposite hands to check the breast. Step 5. Stand up and repeat the same circular motions from step 4 across each breast. Step 6. If you detect anything suspicious in either of these steps, don't panic. Make a note of your findings and schedule an appointment with your doctor immediately.
We
If
can stop
everything
here,
seems
Shravani.
okay,
Yeah.
you
Should we move on?
Yeah, move on to pap smear, please.
Okay.
Two tests are used to screen for cervical cancer, the Pap test and the HPV test. Your cervix is the lower part of the uterus, at the top of your vagina. A Pap test is used to check your cervix for abnormal cells. Abnormal cells can sometimes turn into cervical cancer if they aren't treated. In some cases, your cells may also be tested for infection from a virus called the human papillomavirus, or HPV. HPV causes most cervical cancer, as well as genital warts. The collection of cells for both tests can be done during a pelvic exam. First, your healthcare provider will place an instrument called a speculum into your vagina. The speculum will be opened so that your cervix can be seen. Next, your practitioner will use a scraper or brush to gently collect cells from your cervix. Your cells will be examined under a microscope at a lab to see if any of them are abnormal. The lab may also test your cells to see if they show signs of HPV infection. It usually takes about 1 to 3 weeks to get your test results. If you have questions about these tests or your test results,
We can stop here, Shravani. And in India, it only takes 24 hours to get the result, obviously, because it's much quicker here.
Right.
I'm done with the talk and open to questions.
Yes, thank you so much for that insightful conversation, Dr. Daayana. I'll start taking some questions. We have some questions in the chat box, so allow me to pick up some questions. This is to you, Dr. Vaid. Before I go on to the audience, I'd like to pose a question from my end. not as a doctor, as a clinician, but as a daughter who's lost her father at 58 for a pancreatic carcinoma a year ago. Now, this is a guy who was a chronic smoker all through his life, my father. He had an annual health check every year since he was 42, because being a medical student in medical college, all I could think of was I was petrified all through about when he's gonna come up with something during his annual check, because he's a chronic smoker. None of his annual checks really revealed anything until 2 years ago, wherein suddenly that year's master check also was perfect. His lungs, his heart, his colon, everything. Suddenly 2 years ago, he's developed an episode of rectal bleeds a couple of times. We've observed, we've noticed. He's chosen to ignore it, not inform me. But we finally took him for a consultation with a gastroenterologist. By then, we realized he has developed a de novo diabetes. And then the moment, and he's somebody who's very lean. For a 6-foot man, he has always been 58. So he was not obese. He was slim, had his annual checks, 1 or 2 episodes of rectal bleeds just 2 years ago, got diagnosed with diabetes, and then was put on further investigations and workup at Apollo. And he was diagnosed with a stage 4 pancreatic cancer, which has already spread to his liver by then. Now, sir, I'd like you to throw some light on this.
Shravani, at the very outset, I'm sorry to hear about your father's, the journey with cancer. And, a couple of things which stand out. One, that pancreatic cancer is an aggressive disease. And as I mentioned in my talk, that when we talk of screening of cancers, there have to be 2 factors which need to be satisfied.
Right.
We should have a test which picks up the cancer early enough. And that type of a test, unfortunately, does not exist for pancreatic cancer. And no simple, non-invasive test which we apply can pick up pancreatic cancer early enough. Your father was a smoker. Again, pancreatic cancer is one of the cancers associated with tobacco use. Third, I'm not sure about the family history, but getting a cancer at such a young age, one could probe the family history, because now we are understanding that pancreatic cancer is also one of the genetically driven cancers with the HAR2 new gene. And that would be. And the third thing which stands out is the recent onset diabetes. All recently diagnosed diabetes must have a check for pancreas, especially some sort of a screening modality. Now there are already trials on to recruit the recently diagnosed diabetics to screen them for pancreatic cancer. So that's about this disease. It's an aggressive disease.
Right.
And what we get is, between 2 health checks, there might be the evolution of this cancer, and these are called as interval cancers. So
Right.
one just cannot pick them up.
Right. The reason I wanted to bring this up is there cannot be enough said about tobacco. Like you rightly pointed out in the beginning, it's just not enough how much ever we talk about it. We need to continue to talk and, stop people from smoking. So that's the reason I wanted to reiterate, despite the monitoring and screening and the checks and having the best of the facilities available, tobacco, I think, stands out as one of the biggest reasons in the entire episode. So I would like to thank you for bringing that up at the outset in the beginning itself. So thank you so much for answering that. My second part of the question, sir, is a lot of times, like Dr. Daayana was mentioning, and now how you've mentioned, a lot of us say, we do not have this disease in our family, so why should I be tested? Is one. Two, now that you mention about my father, now that we see this in the family, who should get tested in the families for what type of cancers if they've had it in the previous generations?
About 5 to 10% of the cancers in the clinic will have some sort of a positive family history, be it a close family member, be it a sibling, parent, or grandparent, or one of the cousins. So that raises the suspicion, whenever there is a family member, and particularly for breast cancer, ovarian, colorectal, stomach, pancreatic, prostate. These are the 6 or half a dozen cancers where there is a strong family predilection. Now, we always test first what we call as the proband, the patient who's been diagnosed. as a index case. Other family members would be tested only if a gene abnormality is found in the index case. So we don't apply these tests in a very rampant or in a sort of chaotic manner. There is a algorithmic approach to all that we understand. And majority of the cancers, about 90%, would be sporadic. But these sporadic cases would be linked to those factors which we have enumerated, both these speakers have enumerated in their talks. They would be to tobacco, to obesity, to lifestyles, to so on and so forth, viruses, and all those things. So those 90% would fall in that category.
Okay. I'll move to you, Dr. Daayana. Let's talk about cancers in women. The most common ones you spoke about, cervical and breast. And there is a strong family history that gets discussed here. So, and we know a lot of women, friends, family members, colleagues who've had it, or one of their family members have had it. Could you throw some light on it? When should I get tested, or rather be cautious about if I have a family history in these two cases?
To begin with, Shravani, we should not get too much focused on the family history, because 95% of breast cancers are sporadic. There is absolutely no family history, but the woman could still get breast cancer. So please do not think that family history is one of the strongest risk factors. It isn't. But if there is a member in the family with breast or ovarian cancer, especially if that cancer happened to them before 50 years of age, obviously this woman's going to be far more vigilant and is going to approach the doctors to say that, look, I have a strong family history.
Right.
But every woman, our breast development is complete by the age of 20. After 20 years of age, there is no more breast development. So we say start self-breast examination from the age of 20. Do it on a monthly basis, and preferably do it after your period, because period is associated with some breast heaviness and pain in most women. So at the end of your period, everybody should make it a point to stand in front of the mirror and do what exactly we watched in the video today. Right. So breast examination and breast awareness should start from the age of 20, and it should be regularly done. Every woman in the family should ask the other woman, I've done mine, have you done yours? It should be like that. And from the age of 45, we say have mammograms every 2 years. Is having a mammogram every 2 years enough? Will nothing happen in the meantime? The answer is no. But a mammogram has radiation associated with it. An X-ray goes into your breast. And those X-rays are not very good for you if you keep having too many of them. So once every 2 years is the current American college guidelines, because we don't want too much radiation either. But if you have a strong family history, we say instead of waiting till 45, have it done at 40. But again, going back to what Dr. Vaid just said, if there is a family member with a cancer at a young age, a breast cancer, get the family member tested. Was hers genetic? If hers was genetic, then obviously you're at risk, and we could do your blood test to find out if you have that risk. If unfortunately the person who has had the breast cancer has passed away, and we suspect that person was young and we think you have inherited, you possibly have, then we could do a BRC, a genetic test, to find out if you have the inherited risk of cancer. And if you have, then there is something we can do about it. So if there is a family history, please come see your cancer specialist and we can discuss it. If there is no family history, do not be blasé about it. Still do your monthly self-breast examinations.
Okay, thank you for answering that, Dr. Daayana. Dr. Vaid, I'll come back to you. Can we throw some light about the other two cancers? I think lung, we've spoken enough about. Tobacco, you've emphasized enough. Can we talk a bit about prostate?
So prostate cancer, again, is not much talked about, interestingly. And it's climbing up the ladder. Again, changing the lifestyles, our diets, again, inactivity, obesity, high fat intake, and so on and so forth. There is no single factor. There are risk factors. And high dairy intake, high calcium intakes in the diet, alcohol, all these things are known to up the risk. But the racial factors are very important. Actually, from the Caribbean and the African ancestry, they are more prone. So that is about the risk factors. Now, how do patients present? Now this is something very curious. With aging, the entire body actually shrivels, It's only the prostate gland which actually enlarges. Why that happens, we don't know. With that enlargement comes the set of symptoms, and then these symptoms are generally, related to the urination. One may have to go to visit the loo more often during the day and especially at night. Now, this may be a part of a non-cancerous enlargement of the prostate, but then even the cancerous enlargement of the prostate would lead to similar symptoms. An individual cannot decide on his own that whether this is a non-cancerous or a cancerous. You got to visit the doctor. And as I mentioned, doctor would examine, would do a PSA test depending upon your age, and obviously above the age of 50 years, every 2 years, one should do a PSA test. And below 50, only if there is a strong family history, we advocate as early as 40 years that PSA should be done. And another part of the statistics is, remember that prostate cancer is a disease of the 7th, 8th, and the 9th decade of life. And 65% of the patients would happen above the age of 65. This is something to be remembered. Only 1/3 of the patients would present below the age of 65. But again, the demographics have changed. As the incidence is going up, the age bar is actually going down, and we are seeing patients in their 50s and even as early as late 40s. So nobody's immune. The only way not to get a prostate cancer is not to be a man, actually, and otherwise everybody's prone to, if you're a man.
Right. I get your point, but the idea of the talk today is to tell the audience about the possibility of preventing some cancers and detecting some of them early and have a better prognosis possible for them. So I'd like to throw some positive light towards the end of the session and not to leave them with the feeling of, what you just said about prostate, and almost similar thing what Dr. Daayana said about breast and cervix. So, sir, can we talk about what's the positive light here? Is it really preventable? Is there a scope of better prognosis? Are we headed towards a better, prevention or preventive model for cancer today? You see many patients today. I'm sure Dr. Daayana does too. Tell us something positive about this that we can take back from the session today.
A clear message that almost about 50% of the cases would fall in the preventable category. I would say even more, actually. Talk about men's cancers, as we discussed. Tobacco is a licensed poison which is around. So shun tobacco, and your probability of getting cancer is 30-40% is gone. Adopt a active lifestyle. Exercise, take care of your diet. There are no magical diets, and then there are no magical foods. Have a balanced diet. Eat seasonal fruits and vegetables. Don't get after unseasonal fruits and vegetables. You pay more for that. Nutritional value is already down. So exercise, stay fit, keep your body weight within the limits you are supposed to be. So that is a segment, that's a huge segment, about 50%. Vaccinations, Dr. Daayana has already, she's already said about that HPV vaccination, look at the success rate. Hepatitis B vaccination, again, prevents certain liver cancers. So the good part is that there is a lot which can be accomplished by very simple means and methods. And certain things we cannot change. The genes cannot be changed. The set of genes one has inherited. We cannot change the environment. But whatever is within our own hands, I think charity begins at home. Let's start. Each individual should empower. Love yourself, as I said. Take care of your health. Take charge of your health, and everybody around yourself. That would bring in a more positivity, the vibrancy. Every family talks about health every day at the dinner table or the lunch table, and talks about certain parameters. What is it good that one is doing, and what is it bad one is doing in the day-to-day activity. I think it'll go a long way in making the society as a whole healthier and prevent many diseases. Why only cancer? Healthy lifestyle, active lifestyle is going to prevent diabetes, is going to prevent blood pressure, heart disease, and so many other things.
So it is preventable.
It's
Most of them are preventable, you say. Okay. Dr. Daayana, what do you want to add to that?
Dr. Vaid said it so beautifully that I don't want to say anything and spoil the wonderful words he said. Like he said, it is preventable. I have a lot of cancer patients who are cured of their cancer. They still come to see me, as a follow-up, but I know they're cured because they were caught early. And if I go back and look at all those people who are alive for 10 years or more and are very happy and have gone back to work, they were all the cancers who were picked up incidentally. They never came to me with symptoms. They came to me after a master health checkup where something was not right. Or they came to me because somebody was ill and we advised them to also undergo the health checkup, and then things were picked up. So it all goes back to it. Catch any disease early. It can be cured, or any warning signs, you can prevent it. You wait till you get a symptom. Don't say, when we say, at your age, you could do this, and say, I'm absolutely fine, or I'm actually very slim, I'm not obese, why should I? Or there's no family history, why should I? So don't wait till you get a symptom. By the time you're symptomatic, it's already way too late. So please love yourself. Again, love yourself. Save some money to take care of your health. Prioritize your finances. Take health insurance, because so many people are diagnosed with illnesses they can't afford the medication. So use your finances judgmentally and be clever on how you use your money, and get yourself and your family and your near and your dear checked out on a regular basis. So many of the illnesses can actually be prevented or caught early. Some things are out of our control. We can't keep worrying about them. But what is in your hands, please at least do that.
Right, right. Very rightly said, Dr. Daayana, and Dr. Vaid, of course, you've summarized it beautifully well. The idea of we wanting to do this talk is to tell people that it is preventable, if not all. Like Dr. Vaid said, a good percentage of cancers are preventable with minimal changes in lifestyle. Second is early detection and screening. Like you rightly said, Dr. Daayana, a lot of us, and I think women in particular, do not want to invest in themselves for a lot of reasons, for the kind of society we are part of in our country. We don't like to invest in our health, in preventive health especially, but we are very glad to pay for the post-disease treatment plans and charges. So that's the concept we wanted to discuss today, that cancer, how much ever scary the word sounds, it is just a disease, another disease which is preventable. Most of them at least are preventable, and we can definitely screen and detect early and have a better chance of prognosis. This is the message we wanted to convey. We did not want to bring on the top oncologist to sit with us and scare us about not to be a man or a woman. I think it's beautiful being the humans that we are, but minimal changes and care to screen ourselves and detect early can take us a long way. That's the message we wanted to give to the audience. And like you rightly said, let us all start it from ourselves. So all of you watching and joining us on Facebook who posted the questions, I tried to pick up as many as I can. So pardon me if I've missed any. We will get back to you. The message today is probably, if you haven't had a health check this year or last year, probably this is the time to do it, irrespective of the age. You've heard both the speakers speak. So you could be anybody today. You could gift a health check also to your family member. So that's the message from today. Dr. Vaid, thank you so much for your precious time. We appreciate your time. Dr. Daayana, same here. Thank you so much for joining us. It was wonderful having you. Thank you both of you. And thanks everybody for joining. We'll connect with you with another interesting session next month. Thank you so much. Bye-bye. Bye. Bye.